Hypertension or pressure is a very common condition and is caused when the force of blood in your blood vessels is consistently high. This can cause irreversible damage to your organs if it's left unchecked. Knowing your blood pressure numbers is key to managing your elevated or high blood pressure and preventing complications. Measuring your blood pressure in the comfort of your home is simple. Here's how. At least half an hour before taking your blood pressure, don't eat, drink beverages with caffeine, smoke, or exercise. Empty your bladder and sit comfortably in a quiet environment for at least 5 minutes. While waiting to take the measurement, sit up with your back supported, uncross your legs, and place your feet flat on the ground. No talking. Support your arm at heart level. Use a cuff that's not too big and not too small, and place the cuff around your arm on bare skin. Measure it more than once. Write down the numbers in a diary and discuss them with your health provider at your next checkup. You'll also get further guidance on using the machine and interpreting your numbers correctly.
Remember to take your medication as prescribed and that a healthy lifestyle is key in preventing and controlling hypertension. Cut down on salty, high-calorie and fatty foods. Get physically active, maintain a healthy weight, quit smoking, and reduce your alcohol intake.
It is our healthcare worker and their team heroes who helped contain the COVID-19 pandemic. You cannot see the virus, but you can feel it.
Today we take the time as a team to invite the Lord's blessings on our month-long celebrations in honor of all healthcare workers and on the heels of a very, very challenging last 2 years. There's never been a better time, we believe, to show appreciation for our healthcare workers. The Ministry of Health and Wellness joins a proud nation in expressing thanks to the team of some 25,000 for their committed service to the people of Jamaica. We are pleased to dedicate the month of July to you, healthcare worker, in expression of that gratitude.
We're appreciative for the blessing and grace of the Almighty for bringing us together as one body, representing the public health sector of Jamaica. We have survived many storms and certainly we have overcome.
I'd like to take this opportunity to congratulate and to big up all the healthcare workers across Jamaica. You have done exceptionally well.
You are real heroes throughout the past 30 months. I just want to commend you and to congratulate you.
We appreciate you, we love you, and we thank you.
I implore you to use the opportunity this month of July to enjoy all that we have put together to appreciate your very commendable efforts in healthcare over the period. Thank you.
The Health System Strengthening Program is improving health facilities across Jamaica.
Building a better public health system with comprehensive services.
New and upgraded hospitals.
New and upgraded health centers.
Modern medical equipment.
Digital records.
And the introduction of telemedicine services.
Quality healthcare for all Jamaicans. The Health System Strengthening Program.
Building a better public health system for healthy people and a healthy environment. A message from the Ministry of Health and Wellness.
Hypertension or pressure is a very common condition and is caused when the force of blood in your blood vessels is consistently high. This can cause irreversible damage to your organs if it's left unchecked. Knowing your blood pressure numbers is key to managing your elevated or high blood pressure and preventing complications. Measuring your blood pressure in the comfort of your home is simple. Here's how. At least half an hour before taking your blood pressure, don't eat, drink beverages with caffeine, smoke, or exercise. Empty your bladder and sit comfortably in a quiet environment for at least 5 minutes. While waiting to take the measurement, sit up with your back supported, Uncross your legs and place your feet flat on the ground. No talking. Support your arm at heart level. Use a cuff that's not too big and not too small, and place the cuff around your arm on bare skin. Measure it more than once. Write down the numbers in a diary and discuss them with your health provider at your next checkup. You'll also get further guidance on using the machine and interpreting your numbers correctly.
Remember to take your medication as prescribed and that a healthy lifestyle is key in preventing and controlling hypertension. Cut down on salty, high-calorie and fatty foods. Get physically active, maintain a healthy weight, quit smoking, and reduce your alcohol intake.
It is our healthcare worker and their team heroes who helped contain the COVID-19 pandemic. You cannot see the virus, but you can feel it.
Today we take the time as a team to invite the Lord's blessings on our month-long celebrations in honor of all healthcare workers and on the heels of a very, very challenging last 2 years. There's never been a better time, we believe, to show appreciation for our healthcare workers. The Ministry of Health and Wellness joins a proud nation in expressing thanks to the team of some 25,000 for their committed service to the people of Jamaica. We are pleased to dedicate the month of July to you, healthcare worker, in expression of that gratitude.
We're appreciative for the blessing and grace of the Almighty for bringing us together as one body, representing the public health sector of Jamaica. We have survived many storms and certainly we have overcome.
I'd like to take this opportunity to congratulate and to big up all the healthcare workers across Jamaica. You have done exceptionally well.
You are real heroes throughout the past 30 months. I just want to commend you and to congratulate you.
We appreciate you, we love you, and we thank you.
I implore you to use the opportunity this month of July to enjoy all that we have put together to appreciate your very commendable efforts in healthcare over the period. Thank you.
The Health System Strengthening Program is improving health facilities across Jamaica.
Building a better public health system with comprehensive services.
New and upgraded hospitals.
New and upgraded health centers.
Modern medical equipment.
Digital records.
And the introduction of telemedicine services.
Quality healthcare for all Jamaicans. The Health System Strengthening Program.
Building a better public health system for healthy people and a healthy environment. A message from the Ministry of Health and Wellness.
Hypertension or pressure is a very common condition and is caused when the force of blood in your blood vessels is consistently high. This can cause irreversible damage to your organs if it's left unchecked. Knowing your blood pressure numbers is key to managing your elevated or high blood pressure and preventing complications. Measuring your blood pressure in the comfort of your home is simple. Here's how. At least half an hour before taking your blood pressure, don't eat, drink beverages with caffeine, smoke, or exercise. Empty your bladder and sit comfortably in a quiet environment for at least 5 minutes. While waiting to take the measurement, sit up with your back supported, uncross your legs, and place your feet flat on the ground. No talking. Support your arm at heart level. Use a cuff that's not too big and not too small, and place the cuff around your arm on bare skin. Measure it more than once, write down the numbers in a diary, and discuss them with your health provider at your next checkup. You'll also get further guidance on using the machine and interpreting your numbers correctly.
Remember to take your medication as prescribed and that a healthy lifestyle is key in preventing and controlling hypertension. Cut down on salty, high-calorie and fatty foods. Get physically active, maintain a healthy weight, quit smoking, and reduce your alcohol intake.
It is our healthcare worker and their team heroes who helped contain the COVID-19 pandemic. You cannot see the virus, but you can feel it.
Today we take the time as a team to invite the Lord's blessings on our month-long celebrations in honor of all healthcare workers and on the heels of a very, very challenging last 2 years. There's never been a better time, we believe, to show appreciation for our healthcare workers. The Ministry of Health and Wellness joins a proud nation in expressing thanks to the team of some 25,000 for their committed service to the people of Jamaica. We are pleased to dedicate the month of July to you, healthcare worker, in expression of that gratitude.
We're appreciative for the blessing and grace of the Almighty for bringing us together as one body, representing the public health sector of Jamaica. We have survived many storms and certainly we have overcome.
I'd like to take this opportunity to congratulate and to big up all the healthcare workers across Jamaica. You have done exceptionally well.
You are real heroes throughout the past 30 months. I just want to commend you and to congratulate you.
We appreciate you, we love you, and we thank you.
I implore you to use the opportunity this month of July to enjoy all that we have put together to appreciate your very commendable efforts in healthcare over the period. Thank you.
The health system strengthening program is improving health facilities across Jamaica.
Building a better public health system with comprehensive services.
New and upgraded hospitals.
New and upgraded health centers.
Modern medical equipment.
Digital records.
And the introduction of telemedicine services.
Quality healthcare for all Jamaicans. The health system strengthening program.
Building a better public health system for healthy people and a healthy environment. A message from the Ministry of Health and Wellness.
Okay. Dr. the Honorable Christopher Tufton, Minister of Health and Wellness. Mr. Alex Gaynor, Country Representative, United States Agency for International Development. The Chairman of the Southeast Regional Health Authority, Mr. Wentworth Charles. Regional Director, Sarah, Mr. Errol Green. Regional Technical Director for the Northeast Regional Health Authority, Dr. Patrick Wheatle. Hospital CEOs, Directors of the Ministry of Health and Wellness, Directors and Representatives of the USAID, Representatives of the EPIC Project, distinguished guests, members of the media, good morning. My name is Dr. Natalie Wiley, and I am the Senior Medical Officer of the Kingston Public Hospital. It gives me great pleasure to launch this ceremony, which represents yet another move of progress for the public health system. It's particularly special because we are again witnessing partnership in action with an organization that champions global health and strengthens nation states with humanitarian assistance. USAID distinguishes itself in international development, delivering development assistance to help partner countries in their own journey to self-reliance and resilience. With its track record in global health, USAID's programs have saved lives, protected people most vulnerable to disease, and promoted the stability of communities and nations. Its global health efforts have also served to strengthen health systems and to bring about innovations in healthcare. Today's launch recognizes the collaborative efforts of the USAID-funded EPIC project, meeting the targets and maintaining epidemic control, and the Ministry of Health and Wellness to expand liquid oxygen use in Jamaica. Through the kind support of USAID, the Kingston Public and the Anota Bay hospitals will be retrofitted with the infrastructure required to capacitate storage and supply of medical oxygen. USAID support to Jamaica is a valuable partnership that facilitates improvements of health and quality of life. Today marks another strategic effort that will benefit the Jamaican people and will strengthen the healthcare system as the ministry continues to pursue its goal to attain optimal health for all Jamaicans. At this time, I would like to invite Mrs. Sue-Ann Wallace-Brown, Senior Program Officer for the EPIC project, to bring greetings. EPIC is the implementing partner working on the ground in Jamaica to see the project's fulfillment. Mrs. Wallace-Brown.
Thank you. Good morning, ladies and gentlemen. Dr. the Honorable Christopher Tufton, Minister of Health, Mr. Alex Gaynor, USAID Country Representative, Regional Directors and Regional Technical Directors, hospital CEOs, directors of the Ministry of Health and Wellness, directors and representatives of the USAID, EPIC partners, distinguished guests, members of the media, good morning. It is my distinct pleasure to bring greetings on behalf of EPIC. It is the Meeting Targets and Maintaining Epidemic Control project. It is a 5-year global project funded by USAID, and it is implemented by FHI 360. The project delivers high-quality technical assistance at the community, regional, and national levels. We build lasting relationships with our partners, which seek to address various communicable illnesses, and at this time we are currently addressing COVID-19. Working with our in-country partners, we develop and implement strategies to prepare for, respond to, and bolster health systems to address communicable illnesses and reduce cases of reemergence. We thank USAID for the continued confidence in our efforts and our work, not only here in Jamaica, but also in over 60 countries worldwide. We're pleased to be partnering with the Ministry of Health on this LOX project. We call it LOX for short, liquid medical oxygen, because it is not just for Jamaica, it is for Jamaicans. The work to get us to this stage began several months ago with a rapid assessment, which really sought to determine the feasibility of investing in LOX to bolster Jamaica's health system's capacity to treat with respiratory illnesses. Working closely with the Ministry of Health, we were able to assess the gaps and determine the best use of the available funds to provide catalytic support to address the country's oxygen needs. The project will bring to our hospitals in the public sector an improved capacity to provide life-saving oxygen to the bedsides of patients in need of respiratory support. The hospitals will benefit from upgrades to their physical facility in terms of piping, staff training, and sustainability planning. But the true beneficiaries are the thousands of Jamaicans who will access care at these facilities. We are grateful to USAID for their investment in the Jamaican health system and to the many stakeholders who continue to support the implementation of this project, not just at EPIC, not just at USAID, but definitely at our facilities and also at the regional levels. EPIC looks forward to the continued collaboration with our partners and the successful completion of this project over the next 6 months. Until then, please partner our infrastructural development as we build out the piping systems to better support oxygen delivery at our hospitals. And I assure you, in a very short time, we'll all breathe a little easier. Thank you.
Thank you, Mrs. Wallace-Brown. We are indeed grateful for EPIC's commitment to the project. As we continue to recognize the dedication of our international partners, I will now invite remarks from Mr. Alex Gaynor, USAID Country Representative. USAID is funding the LOX project here in Jamaica. Mr. Gaynor.
Good morning. Thank you, Minister, Dr. the Honorable Minister Tufton, Ministry of Health and Wellness, the regional health authorities and regional technical directors, chief executive officers from the Kingston Public Hospital and Nato Bay, directors of the Ministry of Health and Wellness, colleagues from USAID and EPIC, members of the media, and ladies and gentlemen, good morning. It is an honor and pleasure to be here with you today to officially launch the Liquid Medical Oxygen Project. I think we all know that COVID-19 forcefully showed the world that having a consistent and efficient supply of medical oxygen is critical to save lives. And if we just think back a little bit over a year ago when the third wave came to Jamaica and around the world, there were several countries, including Jamaica, where we saw a spike in hospitalizations due to the severe COVID-19 cases, and that placed extreme stress on the oxygen supplies. And with COVID still present, and the current surge of non-COVID respiratory illnesses globally, as well as flu season coming, there remains a need to ensure that we have a robust and efficient medical oxygen ecosystem. So USAID, as was mentioned, is therefore investing in liquid oxygen infrastructure in 14 countries, including in Jamaica. And the aim of the investment is to improve the efficiency with which oxygen is supplied, stored, and delivered. We know several things about how oxygen ecosystems should operate. We know that oxygen in a liquid form takes up far less space and thus allowing for greater storage capacity than oxygen in gaseous forms. We also know that bedside delivery using piped oxygen is much more efficient than having canisters and moving canisters around to provide the supply. So this project will support the installation of piping infrastructure that delivers oxygen to the bedsides of patients in the Kingston Public Hospital and the Nato Bay Hospital. The project will also provide training to ensure that the efficient management, maintenance, and sustainment of the liquid oxygen ecosystem in Jamaica. This $2 million investment is not only in the physical facilities that will, and not only will the physical facilities benefit, but I think we really have to think about who this benefits at the end, and that's the patients, the Jamaicans that need the oxygen to get healthy and recover from such illnesses. Since the outbreak of COVID-19, the United States has provided approximately $17 million in assistance to Jamaica for the response. And I want to stress this is in addition to vaccine donations. So that is a non-vaccine assistance, $17 million. The launch of this program today is part of that assistance, and it demonstrates our partnership with Jamaica is not just to respond to COVID, but also to prepare for the future. So we're pleased to be able to partner with the Ministry of Health to support their improvements in the liquid medical oxygen infrastructure and systems. It is a long-standing partnership. It's one that we value deeply, and we're glad we're able to partner with you again on this, Minister. For me, the project and our collaboration with the government of Jamaica on this and the people of Jamaica is a further demonstration of the long-standing U.S.-Jamaica relationship. I think you can sum it up very succinctly as saying it's one of neighbors, partners, and friends, and we're glad to be partnering on this again. So thank you very much.
Thank you, Mr. Gaynor. We are indeed grateful for the partnership of the people and government of the United States, so neighbors, partners, and friends. Since the start of the program, we have been using the term liquid medical oxygen in referencing its expansion to 2 of our health facilities. And perhaps you are wondering what this will look like. So at this time, I invite you to turn your attention to the monitor for a video presentation that will enlighten us all.
The COVID-19 pandemic dramatically increased global demand for medical oxygen. Medical oxygen is an essential and life-saving medicine for patients in respiratory distress, including patients with severe COVID-19 symptoms. In Jamaica, medical-grade liquid oxygen is available, but many health facilities do not have the necessary equipment to store liquid oxygen nor piping to transport it to patients' bedsides. This gap is most pronounced in rural areas. In January 2022, through USAID support, EPIC conducted a rapid assessment to determine the feasibility of investing in locks as a means of improving oxygen access. The assessment found that Jamaica has some infrastructure in place with potential to increase locks access. 9 public hospitals had access to liquid oxygen systems, while 9 others had the piping that would allow them to access liquid oxygen if it were available. However, in all cases, the facilities required additional piping infrastructure in order to provide oxygen access more efficiently. Without these systems, health facilities are dependent on oxygen cylinders. Cylinders are limited in the amount of compressed oxygen gas they can hold, and they have to be changed frequently to support patients with severe respiratory illness. Liquid medical oxygen is created in factories designed to produce it at a large scale. Hospitals and regional health authorities procure oxygen from the distributor, who transports the oxygen from the factory to hospitals in specialized trucks. These trucks can keep the oxygen in a liquid state by holding it less than -183 degrees Celsius. The liquid oxygen is then transferred from delivery trucks to cryogenic tanks at the facility, which also keeps it cold. When it is needed, the liquid oxygen moves through a vaporizer that warms it, thereby converting the liquid oxygen to gas. The pressurized gaseous oxygen then moves from the system throughout the hospital via medical-grade copper piping. This piping leads to outlets placed in hospital wards at or between patient beds. The outlets can then be connected to equipment like nasal cannula and ventilators that administer the oxygen to patient. The United States Agency for International Development, USAID, recognizes the critical importance of liquid oxygen to saving lives. That is why they have directed $2 million through EPIC to build out liquid oxygen systems and install piping that will deliver high-quality medical oxygen to patients at the Kingston Public and Anoto Bay hospitals. Kingston Public Hospital is the largest multidisciplinary tertiary care and a trauma center in Jamaica's public hospital system. It is located in Kingston in the southeast region, which is also the most densely populated part of the island. Although sections of the Kingston Public Hospital already have locks access, other sections lack the piping infrastructure and equipment to access locks. Also, as the island's major referral hospital, an additional cryogenic tank is required to meet the ever-increasing demands. The Anoto Bay Public General Hospital in St. Mary is a Type C facility midway between the city of Kingston and the town of Port Antonio. It provides healthcare for people primarily of St. Mary, sections of Portland, St. Anne, and rural St. Andrew. It is currently wholly dependent on oxygen cylinders, but through this investment, it will now have the capacity to deliver oxygen directly to the bedsides of patients with severe respiratory needs. This will reduce the burden on other hospitals in the region. Combined, these facilities will be able to pipe oxygen to an additional 190 beds in the public healthcare system. Each hospital will also benefit from staff training for assigned personnel with responsibility for the liquid system operation. The facilities will also receive 9 months' supply of liquid oxygen and supported to develop sustainability plans for the purchase of liquid oxygen, as well as the costs of operation, maintenance, and periodic evaluation to guarantee the system is working effectively and safely. The improvements to healthcare systems we make today are critical to preparing for tomorrow's health threats. The liquid oxygen systems USAID is installing in Jamaica will help to close gaps in critical care capacity and save lives. The liquid oxygen system helps not just people with COVID, but also those with respiratory-related diseases. This investment will improve patient care at these facilities for decades.
Thank you. So, ladies and gentlemen, this is certainly a life-saving intervention. Thank you to our partners. We are indeed a grateful people, and I'm sure our Minister of Health and Wellness will register his sentiments as he comes now to deliver his remarks. Please make welcome the Minister of Health and Wellness, the Honorable Dr. Christopher Tulsa.
Thank you very much, Dr. Wiley, who is one of our stalwarts in the system at the Kingston Public Hospital. She's smiling from ear to ear because her hospital is a beneficiary of this new project. I see other doctors in the house, and I want to recognize you all. I see the leadership of Sarah, Chairman Charles, R.D. Green, and I want to recognize also, very importantly, the members of the USAID team, Mr. Gaynor, Country Representative, United States Agency for International Development. Thank you very much, sir, and thanks for that excellent presentation, placing everything in context. Miss Wendy Benzerga, is that right? Yes? No? Almost, okay. Who is the health team lead, USAID regional, and other members of the team who are here, directors of the representatives of the USAID team. Want to also recognize members of the EPIC team, maintaining meeting targets and maintaining EPIC control. That's what it stands for, right? Huh? Yes? Okay. It's always better to have a sort of shortened version of, just say EPIC for short, right? And EPIC could mean many things, but in this case, we know what it means. All right, so a lot has been said about the project, and so I don't need to repeat the film content or the speeches around the benefits. I think it's very clear. I want to segue a little, but before that, say how much we appreciate the continued partnership between Jamaica's health system, of course, the U.S. government, and in this case, USAID. That partnership is strong. It continues to get stronger, and this $2 million expenditure in what is, as we have said, a life-saving venture will only enhance the relationship. My fundamental takeaway from this is that COVID, in a very strange way, has brought us significant opportunities to enhance both friendship as well as enhance our public health infrastructure. And I say so in the broadest sense, not just in Jamaica, but for the human race, and certainly in case of our neighbors, the US in this instance. We are working a lot closer because during that COVID period, I think we collectively, even if we did not admit it, understood how vulnerable we are if we operate in silos. I tell people every day that COVID was the greatest equalizer that man has experienced since the last pandemic. Because at every point in time, or at some point in time, every single human being on the planet felt vulnerable to that COVID virus. We didn't know when it was going to turn up, if it's going to turn up, and where we would end up when it turned up. And based on the statistics coming out of the WHO, the revised one anyway, I'm hearing that as much as 15 million members of the world's population suffered their demise because of complications due to COVID. In our country here, over 3,000 people. So, it has forced us to review how we operate. And public health, I think, has gotten an opportunity, again in a strange kind of way, because we certainly regret the loss of lives and the illness and the vulnerabilities that we were exposed to. But there is a duty almost for us to come together to find ways to build the resilience. And partnership becomes absolutely critical to that. And I think this is an excellent manifestation of that. There are other things that we're doing in the system that are intended to bolster that partnership. We are seeing more individuals, charities being willing to volunteer support to build out health systems. This past day, day or so ago, I was in Northern Clarendon, where we opened a new hospital, the Chapelton Hospital, supported by a $1 million US donation from a Jamaican who is a US citizen, who has decided to make that contribution. We are collaborating on training for health workers. And the last time I was in the US, at the PAHO meetings, I met with the US Health Secretary and his deputy, and the discussion was around the announcement by the federal government for 500,000 healthcare workers to be trained. I know the details of that is being worked out, and we look forward to that, again, out of a recognition that not only is it important to secure the internal stakeholders within your borders, but regionally, hemispherically, and certainly globally, there's a lot of value in ensuring that we do what is necessary. So from our standpoint here in Jamaica, we embrace those partnerships, and we would like to see them get more intense, deeper. We have to ensure that our own institutional arrangements accommodate those partnerships, that our own people internally look more warmly to embracing those partnerships. 2 days ago, I was in Montego Bay and Hanover, where our first 6 nurses came in to help us to clear out the backlog of surgery cases. 2 of them are Americans. Well, all 6 are, but 4 originated from Jamaica, then migrated to the US. And they came from different states, as far as California. But they saw the need, responded to the appeal, and 20 Jamaicans over 3 days are better off for it, because they got the badly needed surgeries that they were waiting for years to get in some instances. So that Code Care program is another response to partnership. And in the initial stages, I know questions were asked about it. Why are we not focusing on our own internal solutions, whether it's to fix up operating theaters and so on? All important. But I think the message must get through to all of us that we are going to be stronger together, and that partnerships work as long as we are all on the same page in terms of what we're trying to achieve. I recall, and I'm prepared to say, one of my most vulnerable moments during the COVID pandemic was the wait for oxygen when we got the news coming in from the different institutions that we were either out or close to being out. It probably represented that period, one of the most vulnerable periods of the COVID response, because so many lives were dependent on getting that oxygen. As you know, COVID and its complications lead to issues around respiratory failure, breathing problems. And I recall the system was on the brink of collapse, where we had to be moving cylinders around because one hospital was running out. They were on their final breath, to put it bluntly. And the vulnerability was amplified by, one, a single provider of oxygen. As much as we appreciate what they did, that is the IGL organization, the scarcity of the product, because we did have sources that had committed but could not deliver because it had to be imported, and they had issues, and so we were left at the last minute without. And then just the fact that we were so dependent because of the nature of the illness. And so I want to commend the USAID team in terms of their assessment and their decision to move in this direction, because it is a direction that we have also internally been examining. For starters, I've said publicly that I don't think a valuable resource as liquid oxygen or oxygen should be provided by one source. And that may be controversial to some, but I think we need to expand and be able to create some alternatives, because lives depend on it, and in the case of COVID, as we saw. And so we have to find ways to improve the capacity. In terms of what is being done in the hospitals, the piping, the training, excellent and all needed, because again, the age of our infrastructure doesn't represent the need, the oxygen infrastructure, the piping infrastructure that is needed in order to provide a more efficient service. And I think your assessment is spot on, that we need that infrastructure all the way through to the beds. We have that planned for the new buildings that are going to be developed at Spanish Town, St. Anne's Bay, Maypen, and a few other areas. And so the new infrastructure coming on board will address those issues. But again, the ones that are going to benefit KPH, for example, there is definitely a need based on the age of the plant and the fact that over time, additional capacity has been developed without the necessary infrastructure. So today, I think this is another good development in public health, another example of building resilience, another example of building partnerships, and ultimately, as has been said by many others, it is the people who are going to benefit, the patients. And that's why we're here. We're here for them. So as we celebrate the partnership and look forward to its continuation, we also want to also reflect on how that will benefit and improve the response to those who need it most. So thank you again, and let the partnership continue.
Thank you, Minister. And indeed, this strategic partnership will move us a step closer to better health outcomes for all. We are nearing the end of the launch ceremony, but before we go, we're going to have a symbolic unveiling to mark the launch of what is to come to both the Kingston Public and Annotto Bay hospitals. So at this time, I invite Mr. Alex Gaynor and Dr. Tufton to do the honors, at which time also I'm inviting our media colleagues to come for the photo opportunity.
Ready? Good? All right.
No. Okay.
Sorry.
Right. I also wanted to invite. Okay.
All right. Thank you.
All right.
Sure. Got it? Want it again?
Okay. So distinguished guests, ladies and gentlemen, thank you for your attendance at this media launch of the Liquid Medical Oxygen Expansion Project. Minister says I have been smiling. Yes, I've been smiling because of the opportunity that this presents. Jamaica continues to benefit from the benevolence of its international partners as we move forward to enhance the quality of care provided to our people. So to close this ceremony, I just want to thank. It would not be possible without commitment and partnership, as Minister has said. Again, we extend our gratitude to our friends from the USAID and from EPIC. And I also want to express special thanks to the following persons: the LOCKS project team members, our project management specialist from the USAID, Mrs. Andrea Brooks Hanson, Mrs. Suan Wallace Brown, Mr. Danny Simmons, Mr. Marlon Jones, Director of Ops and Maintenance here at the Ministry of Health and Wellness, who brought his technical expertise in biomedical engineering, and of course our public relations team here at the Ministry of Health and Wellness in collaboration with EPIC for planning this ceremony. So thank you so much. We're going to have another photo opportunity, and I invite you afterwards to join with us for refreshments afterwards at the back. So ladies and gentlemen, thank you so much. Yes, we want to take some more photographs.